This evening for the chairman's report, I'm going to read to you from our service and population priorities. The Geauga County Board of Mental Health and Recovery Services recognizes its role and responsibility to provide quality mental health and substance abuse care to the citizens of this county, as outlined in the Ohio Revised Code, Chapter 340, and the board's mission and philosophy statements. We believe it is imperative that this board provide leadership and guidance in the establishment and continuity of quality programs that benefit the overall health of the individual, their family, and the community. Thank you. We will move into the chairman's report, the CEO, executive director's report.
I didn't see, is Melanie here? Yes. Oh, I was going to defer a little bit. Melanie's from Lake Geauga Recovery Centers. We've just had a very excellent holiday season as far as services to individuals with substance abuse disorders. Would you come up and say a couple of things about what's going on with Lake Geauga Center these days? It'll just be so much easier to let Melanie tell you everything that's happening with them. Oh yeah, no problem.
Thanks for that, Jim. I didn't know I was speaking tonight, so it really has been exciting. I don't know how far back to go, but I'll go back to the grant that we received from the Department of Mental Health and Addiction Services, and we were awarded this grant in December, and this was to help fund a recovery house in Geauga County. And a recovery house is a sober living environment for people who've completed primary drug and alcohol treatment. So this facility will be for men, and it'll house about 5 men. So we're working on that. We're working on securing a place. And it's just another addition in the continuum of care between outpatient, residential, and now this will be another facility as far as the continuation of services. And the other thing that's really exciting that I wasn't quite sure that this would happen because we had applied for another grant back in September of 2013. And this was a capital grant also through the Ohio Department of Mental Health and Addiction Services. And in the past, we were not eligible to write for this grant, but with the merging of the 2 departments, ODATIS and ODMH, our agency was then eligible to write for this grant. And this grant was to help fund, it was a capital request to help fund a new residential treatment facility for women with their children. And right now we have Oak House, which is our women's facility. It's a 16-bed facility, and we do take children under the age of 2. And this new facility would accommodate more children, still 16 women because that is the limit that we are allowed through the Centers for Medicaid and Medicare. And once that house is built, we will repurpose the current Oak House and move the men from our Lake House facility, also a residential treatment facility, into our Oak House facility. So that'll increase our men's beds by about 50%. And it's kind of a domino effect. Then we will repurpose our Lake House, which only has 11 beds right now. We will have about 4 or 5 men that can live there. That'll be another recovery house for men in Lake County. So the grant that we received is the project for the new Oak House is $1 million project, and we just were found out in January that we were awarded that grant, which covers 50% of the project. So we were very excited. My board has done a tremendous job as far as fundraising, and drew up the plans in 2011. So we've been at this for quite a while, and they've done a terrific job of fundraising, but it seemed like climbing a mountain to raise $1 million. That's a lot of money to raise. And so having this grant really makes it within our reach now, and we should be going out for a public bid in March, and then we hope to put a shovel in the ground in June. And as you know, we prioritize our admissions for, it's really Lake and Geauga County residents that are admitted into Oak House and Lake House. Was that it? Did you want me to keep going? Or thank you.
We have you know, Melanie was caught even more off guard because I was the one that said back in the fall, Melanie, don't be upset if you don't get both of these. And don't you know they came and got both. So I think that says a lot about the quality of services, you know, recognized by local and state officials around the what you've provided in that community and for our residents here and for Lake County. So congratulations. Just one other point I'd like to make. You have my written report, so I won't go into any more detail about that and make your evening even longer than it already has been. But one thing I wanted to point out was I hope individuals will visit our website. We do have on the website for parents specifically about how to talk to your kids about these things. It's called Start Talking. There's a link right on our website at www.geauga.org, and it talks about specifically how do you have a conversation with your children about all the issues we've talked about tonight. And there is nothing better. The number one predictor of whether kids will do well in their life is how their parents talk to them. Is if you talk to your kids about drugs, about alcohol, about all these risk behaviors, they have a better chance of succeeding. And there is perfectly good research that bears that out. So absolutely encourage people to go to starttalking.org and find out about how to talk to their kids, even your youngest kids. It starts at a very early age. One of the things that was shocking always is how young these kids do utilize drugs. One of the things we had at one of the past meetings was individuals that have been professionals in the field talking about how kids were starting to drink. They would see them as teenagers or adults, but when you ask them, they start to drink at 8, 9, and 10 years old. So those are really startling and shocking findings, but well researched and well understood. So thank you very much. I think I'll...
Before you step away from the mic, would you talk just a short moment about the Reclaim collaboration?
Oh, yeah, sure will. The Reclaim collaboration is among juvenile courts in, I'm going to get one or two wrong, but there's a huge group, Mahoning, Trumbull, Ashtabula, Geauga, Portage, and Lake, I believe, is in that mix as well. And so they received funding for juvenile justice, actually. This is juvenile justice funding to help to provide aid and services to kids that use the juvenile justice system more often. When they go, they are seen in the juvenile justice system. They go for placement or care, and then they come back to the juvenile justice system. So it really is to stop the cycle of kids cycling in and out of the juvenile justice system. It's really to give some one-on-one wraparound. Again, that's a nationally recognized evidence-based treatment program services, and that's going to be done and monitored through Mahoning, but we're going to use some of our own agencies like Rainwood Mental Health Center will be one of the providers that is providing some of that wraparound and some of those support services. So it'll definitely affect kids. Again, these are the highest and high-risk kids that have a lot of issues that have been seen multiple times. And so those are the kids, if we get to them early, if we can help them and get beyond these issues that they have, they're going to be productive adults. And so it's a lifetime issue that we're trying to face and we're trying to get a handle on and provide treatment for. So I'm really excited. I think it's going to be really exciting and really have some really high-end kids that need some help. Thanks for asking.
Next thing on our agenda is to look at Resolution 1501-1. That is the update of the community plan for fiscal year 2015. You all have a copy of the of the community plan in your packet. Whereas the Geauga County Board of Mental Health and Recovery Services received the Ohio Department of Mental Health and Addiction Plan guidelines for 2015, and whereas the board CEO assures that the board will comply with all the applicable federal, state, and local laws, statutes, and rules, guidelines, and whereas the board is dedicated to utilizing the submitted plan to further enhance and improve the mental health and recovery system of care for all of Geauga County students, be it resolved that the Geauga County Board of Mental Health has reviewed its submission of the Ohio Department of Mental Health and Addiction Services Community Plan Update for 2015 and approves it as written. The Geauga County Board of Mental Health and Recovery Services authorizes the board CEO and the chairman of the board to sign the Geauga County Plan of Mental Health and Recovery Services Community Plan Update for year 2015. Is there any board member that has a question or comment? Excuse me. May I will entertain a motion to accept this update. Thanks, Susie. Is there a second? Thanks, Yasmina. Are there any comments, questions about the update?
Will this be coming in with a copy form or something, or will you at the future time show it to us, or what format?
This is it.
This
This is what's submitted to the state.
Oh, this one back here.
And this actually follows their format.
Yeah, excuse me. Yeah. My mistake.
It has been moved and seconded that we accept the community plan update. All those in favor signify by saying aye. Aye. Those opposed? Those abstain? Thank you. Passed. The next item is Resolution 15-01-2. It is the administration of the Geauga County Regional Communities That Care Youth Survey. Does everybody have a copy of that?
Now, yeah,
Right.
let me talk about this.
Well, it's a resolution.
Should go under old business.
Okay. Excuse me. Jim, did you discuss the financial reports for this evening?
Currently, you'll see the December statements there. We've expended 45.3% of our budget. Our current unencumbered balance currently sits at about 1.78 million. I know the voucher recap is
Voucher
going around
recap.
somewhere. I don't know.
Al didn't get it.
Oh, Al didn't get it.
Ah,
Oh, yeah.
okay.
Look at that too when I was down.
Oh, okay, here's one, we're gonna put that one, now he's looking at this one.
Oh.
Any questions about the financial reports? Thank you.
She coming back with it. So she needs to sign this one. Yep. I don't know, since I was doing it.
Need a little music. Da, 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 da. Oh, there's only one? Where's the other one? Thank you. Voucher recaps for this evening. The voucher recap number 582 for $362,607.67. Do I have a motion to accept this voucher? Thank you. Second? Thank you. Questions? Roll call.
Suzanne? Yes. Al? Suzanne?
Yes.
Al? Jeff?
Yes.
Yasmina? Yes. Linda?
Yes.
Jim?
Yes.
Muriel?
Yes.
Shay?
Yes.
And myself.
Thank you. The other is a service construction schedule number 114. Jim, does this finalize us, or is this something beyond the,
Well, the thermostat guards, it's little things that are added to, to the building. We put the thermostat guards in to prevent residents from adjusting the temperature in the main areas. And then the driveway parking study, that's in addition to the apartment. That's for a separate grant that we're going to use to get a driveway going from the apartments to and through the TLC. I think Jim talked about that
Yes.
a couple months ago.
yes, he did. Okay, thank you. This is schedule, construction schedule number 114 for $1,356. Do I have a motion to accept this schedule?
I make a motion, we accept it.
Thank you, Muriel. Second? Thanks, Shay. Roll call?
Suzanne? Yes. Al? Yes. Jeff?
Yes.
Yasmina? Yes. Linda?
Yes.
Jim?
Yes.
Muriel?
Yes.
Shay?
Yes.
And myself.
Thank you. Old business, Ravenwood Mental Health Center. Update?
Things are going well. Our line of credit's at zero.
Yes.
We purchased a new electronic health record and billing system, and are starting that implementation process. And we're gonna reinstate our 401k in probably April. So I think that's all good.
It sounds very good. Happy 2015. Yes, thank you. Such good news. Okay, moving right along. Now I lost track of my. Oh, Jim, sorry. I'm not used to doing this way. Jim, do you want to discuss about the old business other?
Yes, I will.
Thank you.
I thought at the very least I would present something to try to move us forward one way or another. At least I could throw something out as a recommendation and try to get off ground zero so that there was some resolution one way or the other. In listening to all the comments from December and even from tonight, I think there were a couple common themes. One thing that I've heard are particularly concerns about 4th and 5th grade. This is about communities of care, I'm sorry. I'm thinking, but I'm not necessarily saying what I'm thinking. So in order to, try to come to some sort of compromise and try to meet some of the concerns, I think Craig did a great job. I appreciate your comments and your thoughtfulness about the process. I thought that was very well done. My suggestions are kind of based in this resolution. One is I would suggest that because for myriad of reasons, but because, number one, we don't have a full database on 4th and 5th grade anyway. Schools opt out all the time. Schools have opted out this year, and because this is a collaborative process, they have that, they certainly pick and choose what they want to do. So I would say that, the board decide not to move forward with the 4th and 5th grade surveys in any schools that haven't already done them. I would also say that we have some schools that wanted to do the 4th and 5th grade, and we have those results or those surveys here, and we give them the option of deciding whether we destroy them or whether they're sent in for scoring and the score is sent back to them. That's, again, because it's a collaborative process, that would give the schools an opportunity to decide what they would like to do with that information. You have to remember that, for example, programs like DARE aren't in every single school by this time of the year. So not every child has had, prevention services particularly aimed at these issues. So I think that would be one reason to forego the 4th and 5th grade. I think Craig's comment about the public access to the survey is very well said, and I think we can post the survey. My suggestion is to post the survey on our website. We already have. You can actually go to the front of the website, and we already have the results from the previous communities of care, so you can actually click on and see what kind of things we're talking about in all the different categories, risk and protective factors. So that's already available. We are obligated to do needs assessments under Ohio Revised Code, so this is a way to do that. It is a well-recognized method to do that in the state of Ohio. This basically would continue to include the 6th through 12th grade in this survey, in this survey session, for lack of a better term, 14-15 school year. It would give us 4 years, administrations of the survey. We would have comparative data over about a 10-year period of time, and it would also allow schools. I've already talked to several of the schools that would like to have us come in and talk about the findings in their particular school districts, as well as we've done PTOs, we've done a lot of different churches and things in the past. So we would make that available again, and we'll do a public training when those survey results come back. I think, for lack of better process, this is my recommendation. It's a draft format. Feel free to ask questions, but please, Jeff.
Can we put something in here for passive consent to remove that the parents got to give other than passive consent? Because as Craig said, one of the flaws of this survey was parents were not informed enough and we're not given the opportunity. Just it's a passive consent. I'd rather see that changed.
It doesn't say, where does it say? I'm sorry, I think you're just tired.
No, I'm asking to be put in.
It was added.
Added in.
Understood.
Yes.
Thank you for the clarification.
You mean for the future? Or
Yes.
going forward?
Moving forward.
I would suggest I would just suggest that it would change the administration of the survey. If the school districts that don't currently have it, it would change the administration of the survey, and therefore the results would be skewed because you would have some schools that did active and some that did passive. So just for an outcomes process to be able to compare data that is the same from previous years, you would try to have the same database and try to have the same process for this year as you've had in the past 3 administrations. Just a thought, just a comment. Yeah, I saw Al down at I'm sorry, I know you guys can't see. I'm just trying to facilitate here, so I apologize.
Your comment, I didn't quite understand why it would change the survey based on the fact that if a parent did not want the student to take the survey. I think that's the outcry of the parents here, is that they want to have a vehicle, whether it's a signature or tell the school or whatever that vehicle is, that the student either take or not take the survey. And then, so my question is, why do you feel that's?
Because research would show that right now we have about a 3 to 5% opt-out rate. The research that I've seen shows that it's about you have about a 60% opt-in rate with active consent versus passive consent. And a lot of that is about You just have to get the form back to the school, and the schools get really upset about having to ask for the form 3 and 4 and 5 times and take up school time to get the form. That's all. We can do it. I'm just, trying to compare apples to apples when we look at the data later. I have no personal agenda on whether we do passive or active. I'm just trying to, point out some of the pros and cons of each.
I think in all due respect for this year, we could flag this data because of this issue, and then moving forward, talk to consultants or whoever wrote the survey or does the survey to make sure the data is actual, factual, as Mr. Claypool said, that it's reliable, and talk to them about this whole issue of passive versus restrictive, and see what they come back at. But for this year, I firmly believe we need to have the parents be allowed to take it or not take the survey, make sure they've had it in front of them, being able to read it, and make a conscious effort of deciding whether they should take it or not, and then flag this data for this year only.
Just off the top of my head, another option would be just give the schools the option of doing what either way. I mean, we could write the letter.
You don't want to give the school the
All right.
option. You want this
All right.
board to direct the fact. That's my opinion. This board to direct the fact how it should be done and administered. I'm
A
done.
strategy that I've used in the research that I've been part of kind of marries both of these concerns in the sense that you can have a hard copy consent form saying, yes, we are allowing your child to take this, not take this. However, if you word it in such a way, you can word it where the parent has the active option to say, no, I don't want my child to take this survey. Written into that consent form, though, is non-submission is providing consent.
Oh, I see.
So this, before it goes to school, having to contact somebody 3-4
Yeah, that was.
they don't
That's one of the complaints we've heard over the years was they were a
But
little.
then it gives that child that, the parent, to have that hard copy, sign it, and say no. And it's just an option. I'm not saying that's the way it needs to be done, but we're trying to brainstorm.
Yeah.
I just have, the only question I have about, I understand what you're saying, and I do think a change is needed about all of that. My concern is, have some of these surveys already been submitted where any change on this survey means some parents would get an active role in approving or not, but other surveys have already gone in and those parents didn't get an opportunity, so now we might have an issue with parents who say, wait a minute, because this happened in the middle, if I understand this, some surveys had already been done.
Right.
Some hadn't even been given out, and I'm just wondering if we need to finish it up this time the way it has started, so everybody at least is equal. They may not be happily equal, but everybody has been given the same chance.
I think the problem is, though, you've got someone did an investigation, said it's flawed, now you want to continue to flaw.
Well, that's an opinion that it's flawed, number one.
Well, he did the investigation,
Well, I
it's
don't-
one opinion.
I don't know that, but what do we do with the parents that have already,
If it's a problem, why are we
Submitted it.
complicating the problem? Why are we continuing with the problem? It's a problem. It's a problem. We all agree that it's a problem with the parents not having,
so for the parents that are left, we're gonna
it can't be a passive consent.
send a whole new thing out, is what you're suggesting for
Yes.
whoever's left, which is,
Yes.
as I understand it, only 2 schools.
That would be my suggestion.
Okay.
Jim, well, one more comment. Is it imperative that we do that this year? Could we destroy everything that's been done and just move the whole system 1 year out?
You could, but you're going to incur the cost again. Because the survey cost is in the purchase and the reading of the survey. So I would encourage you not to do that.
And we're talking what kind of cost?
Yeah, I'm sorry. I forget where, yeah, he said, is there what about just throwing the data out and putting it out, and doing it again next year?
It's unnecessary.
Yeah, Shay.
What is the cost?
The surveys, it's a little under $20,000 altogether for everything, for the reading, for the documentation, they send us, they do all the reading, then they send us reports back by school, by county, all that is done for.
It wasn't paid by us, correct?
It's grant funded.
It wasn't paid by us, it was a grant by.
Yes, I'm sorry.
Thank you.
Which schools, curiously on point 3 here, wanted to do 4th and 5th grade?
Oh, thanks for that question.
My pleasure.
Kenston, Newberry, Cardinal. Yeah, no, right. So you're in opted out of third and fourth. Fourth and fifth. Yeah. So it's kind of a mixed bag. So the results wouldn't be very comparable anyway. Is
Kenston, Newberry, and Cardinal schools opted to do this for fourth and fifth graders, and this was the decision of the superintendents there?
yes, yeah, and sometimes the school, depending on the school board or whatever. I know they brought them up to Shay.
Another question. I missed that. Who pays the grants?
Oh, okay. This came from the Ohio legislature for in part of our SHARD response, crisis response.
Okay, and a follow-up on that. Now, the information goes into a database, correct? And is that all this survey does, or do we get grant money from this survey? Like,
We don't
do
get-
a survey the next year, or what? Is it just going to a database? Is this grant money coming from a separate source, or is this something that?
It's one time. Each one of these has been funded for, by a specific entity for a one-time event. It just so happens that we've been able to do it each 3 years. We've had a funding source every 3 years to do it. The data, I'm not sure about exactly how the database works. I mean, what they do is my understanding is, I'm no expert on this, but my understanding is the data goes into a database, but what we get back is specifically about Geauga County, and we will get reports about Geauga County. What we will get out of the database is you can actually, and one of the things we didn't do because of time was show a short video about how they do that, but you can actually compare your community to others that look like you, so that may have the same demographics, may have the same income, may have the same background, those kinds of things. So you can actually, that's the nice thing about the database, you can look at how other communities that look like you compare.
Question, it was mentioned that this data, and what you said, it helps reduce drug use, alcohol use, yet we continue hearing of the heroin problem in Geauga County and Sheridan. I'm confused how we're in an escalation of heroin, but you're saying this all, by using the survey and this data, it's reducing it. So I think that, we're hearing it, we got a heroin problem. Oh no, we're reducing it. Heroin problem, reducing it. Which is it? I'm confused here because I've heard both sides.
Well, I have data from 2007 and 2011. I don't have data from 2014 to tell me whether it's better or worse. So that's the issue at this point.
I think the other thing, if I could just interject there, is that oftentimes when you read the data about the heroin use, they're not breaking it down into ages. We're talking about a survey that goes out to 18 and under, and a lot of times the information you're reading about the heroin use on the rise, maybe looking at 18 and over.
Yeah, but in saying that though, those kids that took the survey in 2006 would be over 18 now.
Well, again, I'm not sure where, when you read those, I read those figures too, where they're coming from, and whether they're breaking them down into age groups. I think it's a fact that the heroin use is growing, but I'm not sure they actually look at in what populations. It is growing in the younger ones, but some of what we're seeing, of course, are people that, you're right, are over 18. It doesn't mean they weren't using when they were under, we just didn't know it.
Right, but
What our survey shows from 2011 is actually very low utilization of opiates, heroin, and prescription medication. For this age group, absolutely, yeah. Because and what you find nationwide is once those seniors graduate, the numbers jump. I mean, across the board for virtually every substance use, and plus you also see numbers jump for kids with mental health issues, things like that, because they have their first episode sometimes with mental illness. So,
Kind of follow up, isn't there someone or some entity in this county that's collected that data on the heroin use, and couldn't we obtain it somehow or request it at least? And
I would think the sheriff's department and the prosecutor, and I would think they'd all have, the judges should have.
yeah, we would have like juvenile judge information, things like that. We also have some on how many kids are being treated now versus 6 years ago or 5. So we could look at.
Would we run afoul of some of you on the board who might have more HIPAA knowledge than I do. Would we be running afoul of that sort of information? Or could we obtain it in just a generic?
We can obtain generic, yeah, absolutely, absolutely. No, that's a good idea. Yeah.
Because I think we also have to remember that not everybody who is abusing drugs or has become addicted gets into the legal system.
Yeah.
That's very, I mean, a lot of people want to look at that as the only source, and the fact of the matter is, I think your treatment people in the community are the ones who are going to give you some really good numbers.
Well, oh, if they have the data, absolutely, yeah, that would be, not to put more work on you, I'm sorry.
Sure. And I think, I don't know, Melanie could probably speak to that, but I mean, in Jaga County, are we still looking at under 18 as mainly treated by Ravenwood? And Lake Jaga is still dealing with adults, which is 18 and over, so we could get two sets of data from all entities. Thank you.
And Ravenwood could supply us with treatment that, for under 18, is
Right.
it going up or going down?
Yeah.
Compared.
Right.
Okay.
I'd like to see that.
Yeah, good.
Yeah. So I'm still,
Oh, yes.
sorry.
What are we doing? Okay. So, could somebody like recap
You wanna-
what it is we want to do here? 'Cause
Yeah,
I
you
don't
want to
know.
amend to require schools that do this?
Remove passive
Or,
consent and require parental consent,
Okay.
and they gotta be informed of it. That's how they get consent.
So how are the tests gonna be, I mean, the survey is gonna be distributed? Are they gonna be sent home with the students?
no, they're done in the school.
In the school, so the
Yeah.
letters are gonna be sent out prior to the children taking the
Yes.
survey. Thank you. Okay.
And as Ms. Van said, is it going to include then some type of a form that they actually have to sign yes or no on and return? Is that what,
I'd be fine with that.
Yeah, that makes sense.
I mean, how
Doesn't
else
make
do you
sense.
get active?
Well, yeah, you get
Have
consent,
something.
active consent, right.
And if
They've
they
gotta be
don't,
signed, right?
and a time frame or whatever, I
It's
guess you
returned
said.
within a certain time.
Right,
frame.
if they
If
don't,
not,
then-
it's considered consent.
Yeah,
I mean,
okay.
that's standard procedure.
Or,
if it-
if they don't return, is it considered consent? If
That,
they don't,
that's what I
if
think
they
is,
opt in out.
could you repeat what you just said? That was interesting.
More or less, in research that we've done, it's been funded by the Department of Defense, National Institute of Health, Mental Health, National Institute of Mental Health, a number of things. And things that we've done is similar to that, had that hard copy of the consent form that they could sign, but within there, within the body, within the text, some sort of language along the lines that not returning this consent is in fact giving consent that your child can complete the survey. Because this way, because you think about feasibility of having the surveys completed, you think about the time and energy it takes to have somebody contact a family member or a parent or somebody numerous times. So you have to take those real world considerations in the mind. So how do you do that by still addressing valid concerns that have been raised, but also be able to collect the data that needs to be collected in an efficient and cost-effective manner as well. And so I don't think there's a perfect way to do that, but from my experience, this is probably one of the better approaches.
Could you write us something, Jim? Or
No.
no, you didn't?
Yeah, point of clarification, I'm not sure what that means. Yeah.
Child is gonna take the survey. The survey. If it's anonymous,
Okay.
how would you know that student got the letter? Is gonna sign it?
Okay, crew.
Time frame. But the survey
I
itself.
have a question.
But how do you know to opt out?
I know we spent a lot of time, but as far as the fourth and fifth graders, I just had a question in relation to that. So is what this proposing from this point forward, fourth and fifth graders, will even have the option to do this survey any longer?
Or could we put it to the school?
Or is it up to the school?
That's a good
It's up to the school.
Yeah, we can make that.
Okay, so,
I guess I need to understand.
so they have, we're not saying here we're gonna automatically give it to them, but the schools can decide that.
Yeah, that's fine with me.
Or do we wanna leave it up to the parents? They've gotta have X number of parents of the school, 50% gotta agree to do it, or else we're not doing it. I mean, it should be up to the parents, shouldn't it?
They still opt out.
Yeah, there's the opt-out procedure.
Well, and use the same opt-out procedure.
So are we saying if it's not signed or brought back in a certain amount of time,
It's an
it's,
admission
it's
of,
an, okay, it's they're opting out.
They're opting
In.
in.
To do the survey.
no response means
Right.
we're, okay, we're opting in.
You know, let's say they got the letter on January 1st, said your consent form or The consent to not complete the survey has to be received to us by, January 20th. Failure to do so, I don't want to use the word failure, but will be considered that you are providing consent for your child. Something along those
But
lines.
the
Sort of
child
like it's-
still has the opportunity to not take the,
And the child,
Right.
exactly.
Right.
This is just parental consent.
Yeah,
we're
I
talking
like
about.
that point, yeah, that's a good
Right.
point.
And then how this gets affected by the age group that is doing this, that's another concern that has to be considered. Because there is legal guardianship over children of a certain age, and if their parent says, no, they can't do that, that child cannot do that.
Right.
18 years old,
It's sort of
parents
like
can say no, but that
it's-
child and that teen can say, well, I still want to take
It's
it.
sort of like receiving a summons, and if you don't respond, you're almost in default.
Right.
That's how I kind of see it. I don't know if
Is
that's
there
a good way to see it.
Is there a format that every school takes to take these surveys? A standard format, like a certain period of time
Yes.
during the day?
Well, no. The school has the option of doing the survey at a convenient time for them. The 6th through 12th grade survey is a 40-minute survey. And we tell them that when we deliver the communication to the superintendent and to the principal, that it's a 40-minute survey through 6th through 12th graders. So they take it in one period on one day. We deliver it to them. This year we delivered it to them right after Thanksgiving and said we would like to pick them up before Christmas break. And so they had X number, couple of weeks in order to administer the survey, and then they call us and tell us it's complete, and then we go back and pick it up. Does that answer your question?
Well, I wanted to know if it was given, if parents were receiving the letters and there was a time period that was lapsed between them actually taking the survey. So when the child goes back to school, although his parent may have told him, you're not taking this survey, they get to school and they just take it because some time has lapsed. It's no longer important to the child anymore.
But
So
there-
they're in class and they'll just take it.
No, because there would be a list, I would think, of all these forms come in, and you're checking off the kids' names. No take, no take, no take, and the ones that said, my child isn't taking it, I'm sure they would have a study hall or something where those kids would go. The kid doesn't have the choice, because you better do something with that consent form.
Well, I hope so.
I mean, yeah, isn't that right? And
Yes.
you have a list.
Yeah, they
Let's
redact, they
do
actually
this.
have lists of,
Yeah,
that
so,
they redact, yeah.
Right.
So the schools knew, at least I didn't see every single school, but the ones I talked to or saw, they were definitely, they knew who was not to
Okay.
take the test.
Okay, so for resolution 15-01-2 draft, can we ask Jim to add a communication, ask Jim Pontu to add a communication to that draft to deal with the consent issue? Send it out to the board for approval. We need to move forward with the to finalize the surveys, or we're going to be getting the data in August. So if Jim, if you could do that within, what would you think you would need? What kind of time would you need? Okay.
Ask my toddler, she'll be sleeping.
Okay.
Hey, man.
A week, 2 weeks?
Give me at least 2 weeks,
Okay.
please.
Okay. Yeah, before the next meeting.
Yeah, I mean, I'll definitely have it before the next meeting. I'd like to give enough time for everybody to be able to review it. That's good.
Okay. So are we gonna pass this with that codicil, or? Okay. In that case, this will go back to the drawing boards for our next meeting. Oh, okay. Is there any new business? Anybody on the board have new business? Yes, Muriel?
It's Al's birthday.
Whoa, Al! Happy birthday, Al. Do I have a motion for adjournment? Second. Jeff, Muriel seconds. All those in favor signify by saying aye. Those opposed, abstain. Meeting over.